Here in Utrecht we have the largest stem cell transplantation program in the country. We are in the midst of a large university children's hospital. We transplant for all indications and we have close links to both our referring hospitals as well to our international colleagues. In this transplant unit we focus on transplants for leukemia and inborn errors. We do a lot of cord blood transplantations and we try to improve the conditioning regimens as well as the whole treatment plan for our patients who normally have more problems than just their hematopoiesis. Actually, we're one of the largest centers for cord blood transplantation in children in Europe. We've done over 200 cord blood transplants in the past years. And for that reason, we focus on improving cord blood transplantations and we cooperate internationally as much as possible on this topic. In the country, we cooperate with the paediatric oncologists, the immunologists, all our referring hospitals and physicians, and internationally we are expanding our cooperation. Dr. Lindemans has been to New York recently, and internationally we work together on Fanconi anemia, on cord blood transplantation, on Hurler syndrome, so there are many subjects for which we are well known throughout the world.
Within our lab research group we have a special interest in getting better disease control in malignant diseases. And to achieve this goal we have a couple of strategies. The first strategy is to develop cord blood derived dendritic cell vaccines. Secondly, we are working on low toxic predictable conditioning regimens. And thirdly, and that's mainly also to monitor the effect of the dendritic cell vaccines and the predictable conditioning regimens, we have built an immunomonitoring core facility. Our first vaccine has been developed and will be trialed in a phase 2 study later this year. So we hope to open this study in August 2016.
We have a number of gut graft versus host disease studies in Utrecht. We have both clinical studies and experimental studies. The main clinical trial that we're doing is a phase 3 trial with MSC plus steroids versus steroids alone as a first-line treatment in gut graft versus host disease. And the experimental research I'm doing is mainly based on the role of the epithelium in graft versus host disease and the epithelial and immune cell interaction. Recently I worked for a year in New York in the Memorial Sloan Kettering Cancer Center in the group of Marcel van den Brink and Alan Hanash. And we worked together on the role of epithelium and in graft versus host disease, and specifically how IL-22 and interleukin-22 could protect in gut graft versus host disease.
Here at the Paediatric Transplant Ward of Wilhelmina Kinderziekenhuis in Utrecht, we have a small team of dedicated doctors. Special in our team, I would say, is its small size, its self-criticism, its aim for continuity in patient care, and its close collaboration with other departments in the hospital.
We have a very diverse team with different ages, different experience, different qualities. We respect everyone's qualities, and we want to make sure that we provide a safe environment for everyone, for the kids, but also for our colleagues. We have a very emotional ward. Of course, kids die here as well, so sometimes it can be very hard and emotional, and we try to look after the families and the children, of course, but also for each other, to make sure that everybody can handle it, and if not, there is help available.
I think the future for this center is really bright and excellent. If you look on the one side, there's the Hubrecht Institute, world famous development biology research institute, headed by Hans Klevers, who's also the research director for the Princess Maxima Center, the largest center for pediatric oncology in Europe, that's being built on the other side of our hospital, and it will open in 2018.
The Utrecht Paediatric SCT team has a vast experience in cold blood transplantation, individualised conditioning regimens, expertise in metabolic disorders and marrow failure syndromes. We provide new treatments for graft versus host disease in a focused team collaborating internationally. We look forward to a bright future as an inspiring environment for world-class research.